Have you ever felt something unusual in your body, a sudden change, a strange sensation, or a discomfort that didn't quite make sense, and thought to yourself, maybe it's nothing? In many cases, we're quick to shrug these things off, telling ourselves we're just tired, stressed, or getting older. But the truth is, our bodies have an incredible way of communicating with us. When something serious is happening beneath the surface, it often tries to warn us, not with sirens or flashing lights, but with subtle symptoms that can be easy to ignore. What many people don't realize is that some of these symptoms, though seemingly minor or common, can be early warning signs that the body is in serious trouble. In fact, doctors often recognize specific symptoms that signal the body may be nearing a point of failure. These aren't just passing discomforts, they are messages from within, often indicating that critical systems like the heart, lungs, or brain are under threat. If left unchecked, these signs could mean the difference between life and death. In this video, we're going to take a closer look at 8 major warning signs that you should never ignore. These are the kinds of red flags that experienced doctors take seriously, signs that something could be going wrong on a deeper level. From sudden, unexplained fatigue to dramatic weight loss, difficulty breathing, or sharp chest pain, these symptoms might seem like part of everyday stress or aging. But when they appear without a clear reason or worsen over time, they become your body's desperate cry for help. We'll explore each of these symptoms in detail, what they look like, what they might mean, and most importantly, what you should do if they happen to you or someone you care about. It's not about causing fear, it's about offering awareness. By understanding these signals, you'll be empowered to make the right decisions for your health, and maybe even save your own life or someone else's. Stay with us until the end. Every minute of this video could give you the tools to act early, to ask the right questions, and to recognize when something isn't just a passing ache or pain, but a serious call to action. Your body speaks. The key is learning to listen before it's too late. Number 1. Unexplained extreme fatigue. Have you ever woken up after what should have been a full night's rest, only to find yourself completely drained, as if you hadn't slept at all? Or maybe you've started struggling with daily tasks, things that used to come easily, like walking to the mailbox, cooking a meal, or even holding a conversation, and now they feel overwhelmingly difficult. If this sounds familiar, it may not just be tiredness. It could be a sign that something much more serious is going on inside your body. There's a big difference between normal tiredness and unexplained extreme fatigue. Tiredness usually has a cause. Maybe you didn't sleep well, worked too hard, or haven't eaten properly. But extreme fatigue that lingers, worsens, and doesn't go away even with rest is a warning flag. It's your body's way of telling you that it is overworked, not because of what you did that day, but because something is failing inside. Doctors often say that when they see this kind of deep, ongoing fatigue, especially in older adults, they begin to worry about serious conditions like heart failure, kidney disease, chronic infections, or even cancer. These are not minor issues, and fatigue is often one of the first and most overlooked symptoms. This type of exhaustion is not something a cup of coffee can fix. It's the kind of tiredness that sits in your bones. You may feel weak, lightheaded, or simply unable to focus. You might notice that you need to lie down more often, or that you're withdrawing from activities you once enjoyed, not because you've lost interest, but because your body simply can't keep up anymore. One particularly alarming sign is when this fatigue comes on suddenly or gradually but noticeably worsens over time. For example, if you used to go for a walk every morning and now find yourself breathless after just a few steps, or if you need a nap after every small task, that's not normal aging. That's a red flag. What's happening inside your body during this kind of fatigue? Often, your vital organs are under stress. The heart may not be pumping blood efficiently, meaning your muscles and brain aren't getting the oxygen they need. The kidneys may not be filtering waste properly, causing a buildup of toxins. Or your immune system may be fighting a hidden disease like cancer or an infection, silently draining your energy behind the scenes. So, what should you do? First, pay attention. When did the fatigue begin? Has it been getting worse? Are there other symptoms, like shortness of breath, swelling in your legs, or changes in appetite? Even if it's just tiredness, it's worth having it checked. Many serious illnesses are treatable when caught early, and fatigue is often the first clue. Don't accept extreme tiredness as just part of growing older. It's not. Aging doesn't mean losing all your energy. If you feel like your body is constantly fighting an uphill battle, don't wait. Talk to your doctor. Ask for blood tests, heart checks, or a full health evaluation. It's better to catch something early than to wait until it's too late. Your body is wise. It knows when something isn't right. The challenge is listening and acting when it whispers, not just when it screams. Number 2, sudden and severe chest pain. Have you ever felt a sudden, sharp pain in your chest, as if something heavy was pressing down on your rib cage, making it hard to breathe, panicking and unable to think of anything else? If that happens, consider it a serious warning bell from your body, because sudden and severe chest pain can be a sign of an impending heart attack or a serious problem with the aorta, a situation that can be life-threatening if not treated promptly. According to doctors, sudden and severe chest pain is one of the clearest signs of a heart attack, myocardial infarction, or an aortic dissection, both of which can be fatal if not treated promptly. The problem is that many people mistake this sign for heartburn, indigestion, or muscle pain, and therefore miss the golden time to treat it. The pain can appear as a tight, pressing, burning, or heavy feeling in the chest. It can radiate to the neck, shoulder, jaw, or down the left arm. Some people don't even feel any pain, but instead experience shortness of breath, nausea, cold sweats, or dizziness, especially in older people or women. A common occurrence is aortic dissection, when the wall of the aorta, the body's largest blood vessel, tears and blood leaks into the inner layers, causing severe pain, often described as a tearing sensation in the chest or back. Without emergency surgery, this condition can be fatal within minutes to hours. The problem is that many people tend to wait or reassure themselves, thinking it's probably fine, or it will go away after a while. But the truth is, with chest pain this severe and unusual, time is of the essence. Every minute that passes without medical intervention increases the risk of permanent heart damage or death. It's important to remember that heart attacks don't always look like the movies, and not everyone will collapse from the pain. Some people may just feel a slight discomfort in their chest, or a dull ache that doesn't immediately relate to the heart. But doctors consider any chest pain that's unexplained, comes on suddenly, or is accompanied by other symptoms to be cause for concern. So what should you do if you find yourself in this situation? Don't try to fight it. Don't drive yourself to the hospital. Call 911 immediately, 911 or your local health service. Sit still, relax, and wait for help. If you have aspirin on hand and aren't allergic, you can chew a small tablet to help thin your blood while you wait for help, but only if you've called for professional help. You should also listen to your body more often, especially if you have a history of high blood pressure, diabetes, high cholesterol, or a family history of heart disease. Signs like chest pain during exertion, unusual shortness of breath, or palpitations are also early warning signs to watch out for. Finally, remember that chest pain should never be taken lightly. It could be your body's way of calling for help. And when it comes to the heart, it's never a bad idea to be cautious. Number 3, difficulty breathing or shortness of breath. Breathing is something we do without thinking, but when it suddenly becomes difficult, it's one of the most alarming signs your body can give. Shortness of breath, especially when it comes on without warning or worsens over time, should never be ignored. While it's easy to associate breathlessness with aging or lack of fitness, doctors warn that unexplained difficulty in breathing can be a signal of something far more serious, even life-threatening. Imagine sitting comfortably, doing nothing strenuous, and suddenly feeling as if you can't get enough air. It might feel like you're breathing through a straw, or like there's a weight on your chest. For many, this sensation is brushed off as anxiety or fatigue, but in reality, it could be your heart or lungs sending out a desperate cry for help. One of the most dangerous causes of sudden breathlessness is a pulmonary embolism, a blood clot that travels to the lungs and blocks blood flow. This can happen after long periods of sitting, such as during a flight or after surgery, but it can also strike without warning. Early symptoms may feel mild, perhaps a little tightness in the chest, but can quickly progress to severe difficulty breathing, chest pain, and even collapse. If not treated immediately, it can be fatal. Another common culprit is congestive heart failure. When the heart is no longer able to pump blood effectively, fluid can build up in the lungs, making it harder to breathe, especially when lying flat. Many people report waking up gasping for air in the middle of the night, or feeling winded after simple activities like walking across the room. This kind of shortness of breath is a critical red flag that your heart may be under serious strain. Even more silently dangerous is a silent heart attack. Unlike the classic heart attack that comes with crushing chest pain, a silent heart attack may present as breathlessness, lightheadedness, and cold sweats. Because the symptoms don't match what people expect, they often delay seeking help until it's too late. This is especially common in older adults, women, and people with diabetes. Doctors emphasize that breathlessness should not be ignored just because it's subtle. If you feel like your breathing has changed, if it takes more effort, or you find yourself getting winded doing things that used to be easy, it's time to pay attention. Especially if this change is sudden or worsening, it could point to a cardiovascular issue, chronic lung disease, or even a respiratory infection like pneumonia. So what should you do if this happens to you? The answer is urgent but clear. Seek medical attention immediately. Sit down, stay calm, and avoid exerting yourself further. If you experience breathlessness alongside other symptoms, like chest pain, dizziness, or a rapid heartbeat, call emergency services right away. A fast diagnosis could make all the difference in preventing a major health crisis. As we age, it's natural for our bodies to slow down, but struggling to breathe is not a normal part of getting older. It's your body telling you that something needs attention now, not later. By recognizing this sign and acting quickly, you give yourself the best chance to recover and continue living a healthy, independent life. Number 4. Rapid and unusual weight loss. Losing weight without trying might seem like a blessing to some, but for older adults, sudden and unexplained weight loss is often a dangerous warning sign. It's your body's way of telling you that something is going very wrong beneath the surface, something that cannot be ignored. As we age, it's normal for our metabolism to slow down or for our appetite to change. But there's a clear difference between gradual shifts in weight and rapid, unintentional weight loss, especially when you haven't changed your diet or activity level. If your clothes start to hang loosely, your belt needs extra tightening, or friends comment that you look thinner when you've made no effort to slim down, it's time to pay attention. Doctors say that losing more than 5% of your body weight within 6 months to a year without trying is a serious red flag. One of the most common and most concerning underlying causes is cancer. Certain types of cancer, such as pancreatic, lung, stomach, or colon cancer, often cause the body to burn through calories rapidly, long before other symptoms appear. By the time the weight loss is noticed, the disease could already be at an advanced stage. But cancer isn't the only possible culprit. Chronic infections, such as tuberculosis or HIV, and autoimmune conditions like lupus or rheumatoid arthritis can also cause weight to drop unexpectedly. These illnesses put the body in a constant state of inflammation, using up energy and nutrients even when you're resting. Another major cause of weight loss is malabsorption, when your body isn't absorbing nutrients from food properly. This can happen due to conditions like celiac disease, chronic pancreatitis, or intestinal problems. Despite eating normally, you may become undernourished, fatigued, and weak as your body fails to retain the fuel it needs. Don't overlook mental health either. Depression and anxiety, both common in older adults, can lead to reduced appetite and unintentional weight loss. So can social factors like isolation, grief, or the inability to prepare proper meals. For many seniors, losing weight can be both a physical and emotional issue, and both deserve equal attention. Sometimes the cause may even lie in the heart. In advanced stages of heart failure, the body goes into a catabolic state, breaking down muscle and fat to survive. This kind of wasting isn't just unhealthy, it's life-threatening. So what should you do if you notice unexplained weight loss? Act quickly. Don't chalk it up to aging or assume it's a good thing. Keep track of your weight, take note of other changes in your health, and talk to your doctor as soon as possible. A full checkup including blood tests, imaging, and a nutritional assessment can help uncover the root cause before it becomes irreversible. In short, weight loss that happens for no clear reason is not something to celebrate. It's something to investigate. Your body is speaking to you, and in this case, silence can be deadly. The sooner you take it seriously, the better your chances of addressing the issue and preserving your strength, independence, and quality of life. Number 5. Memory loss, confusion, sudden personality changes. Here's something deeply unsettling about losing touch with your own mind. For many older adults, sudden confusion, memory loss, or personality changes are often brushed off as just getting older. But doctors warn that when these symptoms appear quickly or without explanation, they could be a sign of something far more serious, something that requires immediate attention. Think about it. You or a loved one suddenly starts forgetting familiar names, gets lost in places they've known for years, or begins to act out of character, irritable, distant, or unusually emotional. These aren't just harmless quirks. They could be early warnings of a stroke, a brain infection, or even acute neurological decline. One of the most alarming causes of sudden mental changes is a stroke, especially when parts of the brain controlling speech, memory, or behavior are affected. The signs can be subtle at first: difficulty finding words, strange decisions, or temporary disorientation. Some people may recover quickly, thinking it was just a weird moment. But in reality, these episodes could be transient ischemic attacks, TIAs, also known as mini-strokes, which often precede a major stroke. Missing these clues can be a devastating mistake. Another possible cause is infection, especially in the urinary tract or lungs. While it might seem odd, infections in older adults often don't cause fever or pain first. They go straight to the brain, causing sudden delirium, confusion, or even hallucinations. A cheerful, independent person may suddenly become agitated, drowsy, or unresponsive. Family members might think it's dementia setting in, when in fact, it's a treatable infection that's rapidly spreading. And yes, dementia-related conditions like Alzheimer's disease or Lewy body dementia can also start with sudden or subtle personality changes. A once patient and calm person may become suspicious or anxious. Small things, like leaving the stove on or repeating stories, may seem like simple forgetfulness but are often the first signs of cognitive decline. Unfortunately, many older adults and their families dismiss these symptoms. They wait, hoping things will improve, or assume it's just a part of aging. But the truth is, sudden mental changes are not normal, and waiting could mean missing a crucial window for treatment or intervention. So what should you do if you or someone you know experiences these symptoms? Act immediately. Keep a journal of any unusual behavior or memory issues. Ask questions. When did it start? Is it getting worse? Are they having trouble with things they used to do easily? And most importantly, don't wait for it to pass. Seek medical help as soon as possible. A brain scan, blood tests, or neurological evaluation could reveal life-threatening conditions that, if caught early, can be managed or even reversed. In many cases, confusion and personality changes are a cry for help from the brain itself. Ignoring them is like watching smoke rise and waiting for the flames. When it comes to the mind, every second counts. Remember, just because something is common with age doesn't mean it's normal or safe. Trust your instincts. Speak up. And when something feels off, don't delay. Early action can protect not only memory, but life itself. Number 6. Severe and persistent abdominal pain is a symptom that should never be ignored, especially when it lasts for several hours or is more intense than typical stomach discomfort. Many people tend to dismiss abdominal pain as something simple, such as indigestion or a minor stomach issue. But doctors caution that intense and persistent pain in the abdomen could signal a serious, life-threatening condition. One of the most critical concerns when dealing with severe abdominal pain is the possibility of a ruptured abdominal aortic aneurysm, AAA. This condition occurs when a weak section of the body's largest artery, the aorta, bursts, causing massive internal bleeding. The pain associated with a ruptured aortic aneurysm is often described as a deep, sharp, and persistent ache that radiates through the stomach, lower back, or sides, and it usually comes with a pulsing sensation with each heartbeat. If this type of pain strikes, it's not something that can be ignored. The quick rupture of an abdominal aortic aneurysm is extremely dangerous and can be fatal within minutes if not treated immediately. Immediate medical attention is critical for survival, so it's important to act fast if this pain occurs. Another potential cause of severe abdominal pain is intestinal blockage. This condition, where the intestines become obstructed, can cause sharp, constant pain, along with nausea, vomiting, and bloating. When blood flow to the intestines is compromised due to a twisted bowel, clot, or other causes, immediate medical intervention is necessary to prevent further damage. If the pain is accompanied by a swollen or hard abdomen, especially if the person has not had regular bowel movements, it could be a sign of a blocked intestine, which requires urgent care. Furthermore, pancreatitis, an inflammation of the pancreas, is another serious condition that causes severe abdominal pain. This often occurs in the upper abdomen, sometimes radiating to the back, and can become worse after eating. People with pancreatitis may experience intense pain that becomes unbearable, making it difficult to perform even basic activities. The condition can progress to organ failure, so it is vital to seek medical help immediately to prevent long-term damage. For some people, gallbladder issues such as gallstones or inflammation can cause sharp, stabbing pain just below the ribs, which can worsen after eating fatty foods. Many mistakenly attribute this pain to simple indigestion, but if it's severe and accompanied by symptoms like fever or jaundice, yellowing of the skin, it could indicate a gallbladder attack that requires urgent attention. While these conditions are some of the most serious causes of abdominal pain, they are not the only ones. Infections such as appendicitis or conditions like gastrointestinal ulcers can also cause severe discomfort. What's important is that if the pain is persistent, intense, or accompanied by other symptoms like fever, vomiting, or dizziness, it's crucial not to wait for it to get better on its own. Don't take abdominal pain lightly. Severe pain that doesn't go away could be your body signaling a serious underlying issue. Whether it's a ruptured aneurysm, a blocked intestine, pancreatitis, or another critical condition, the key is to seek help immediately. Time matters when it comes to abdominal pain, and early intervention could make all the difference between recovery and a much worse outcome. So, if you or someone you know experiences intense, persistent abdominal pain, don't hesitate. Call for medical help right away, especially if other concerning symptoms appear. In many cases, addressing the problem quickly can prevent long-term damage and even save a life. Number 7. Memory loss or sudden changes in mental status are serious health warning signs that seniors should not ignore. When this happens, it can be a sign of serious medical problems, such as a stroke, brain infection, or Alzheimer's disease. In fact, memory loss and changes in behavior and cognition can affect the quality of life of seniors, making it difficult for them to maintain daily activities and causing problems with communication and living. One of the most common causes of sudden memory loss is stroke. A stroke occurs when blood cannot reach a part of the brain, causing brain damage and disrupting the function of other body parts. Signs of a stroke can include sudden changes in memory, disorientation, or difficulty speaking. When a stroke occurs, some people may experience sudden memory loss or loss of awareness of time, place, and people around them. This is a medical emergency and requires prompt intervention to minimize damage to the brain and prevent dangerous complications. Another cause that can lead to sudden mental changes is a brain infection, such as meningitis or encephalitis. These diseases can occur when bacteria or viruses attack the central nervous system, causing symptoms such as high fever, severe headache, nausea, and especially memory loss or cognitive disorders. Older people have weaker immune systems and are more susceptible to infections, so any changes in memory or behavior should be taken seriously and treated promptly. Alzheimer's disease, a common type of dementia in older people, is also a cause of sudden memory loss and mental changes. Alzheimer's disease causes a gradual decline in a person's ability to remember, perceive, and make decisions. Initially, the disease may only cause difficulty remembering small details, such as the location of objects or the names of loved ones. However, as the disease progresses, symptoms become more severe, and the person may experience severe memory loss, not recognizing loved ones, or significant behavioral changes, such as confusion, irritability, or an inability to communicate effectively. When these changes occur suddenly and are unexplained, the patient's loved one should seek medical help to determine the cause and find appropriate treatment. In addition to specific medical conditions, sudden changes in mood and memory can also be caused by other factors such as lack of sleep, psychological stress, or medication use. These factors can negatively impact the mental health of older adults and impair their ability to remember, think, and react. For example, when the elderly are under prolonged stress or psychological pressure, they may feel tired, anxious, and easily forget important details in daily life. Moreover, improper use of drugs or side effects of drugs can also affect the patient's memory and mood. Therefore, when noticing any signs of memory loss or sudden psychological changes in the elderly, relatives need to pay attention and encourage them to see a doctor as soon as possible. Timely detection and treatment of memory-related problems not only helps patients maintain their health, but also helps improve their quality of life. It is important to never ignore these signs, as they can be indicators of serious health conditions that need to be treated immediately. Number 8. Urinary incontinence or changes in bowel habits are serious health warning signs that should not be ignored by the elderly. When the body begins to change, especially with symptoms related to the excretory system, it can be a sign of many underlying diseases that, if not detected and treated promptly, can lead to serious complications. Sudden changes in bowel habits, such as frequent urination, little urination, painful urination, or blood in the urine, can reflect a serious health problem that the patient is facing. One of the common causes of urinary incontinence in the elderly is urinary tract infection, UTI. This infection can cause a feeling of frequent urination, urgency, pain when urinating, or even incontinence. Symptoms of a urinary tract infection may start out mild, but if left untreated, the infection can spread and cause more serious problems such as cystitis, kidney infection, or sepsis. As people get older, their immune systems may not be as strong as they once were, making them more susceptible to infections and less likely to notice early signs. If you have a frequent urge to urinate, a burning sensation when urinating, or pain when urinating, you should see a doctor to determine the cause and get prompt treatment. Changes in bowel habits can also be a sign of prostate problems in men. When the prostate is enlarged or has other problems, you may have difficulty urinating, have intermittent urination, or even be unable to urinate. An enlarged prostate is a common condition in older men and can cause frequent urination at night, a phenomenon called nocturia. While this condition is not always dangerous if left untreated, it can lead to more serious health problems, such as urinary tract infections or bladder damage. In addition to infections and prostate problems, urinary incontinence can also be a sign of kidney problems. Chronic kidney failure is a common condition in older adults, especially those with a history of diabetes or high blood pressure. When the kidneys no longer function properly, the body cannot remove waste and excess water normally, leading to changes in urination habits, such as less urination, more urination, or incontinence. One of the typical signs of kidney failure is frequent urination at night, which is also accompanied by fatigue and swelling in the limbs. If not diagnosed and treated promptly, kidney failure can lead to serious complications, including end-stage kidney failure. Bladder problems can also cause urinary incontinence. Improper bladder function, such as in the case of an overactive bladder or a weak bladder, can lead to urinary incontinence or frequent urination. This condition can cause great inconvenience in daily life, making the patient feel self-conscious and uncomfortable. These conditions are common in older adults and need to be controlled to avoid affecting their quality of life. Finally, problems related to urinary disorders can also be caused by side effects of medications. Many medications that older adults take to treat conditions such as high blood pressure, diabetes, or cardiovascular disease can affect urinary function. Diuretics, for example, can cause frequent urination or loss of control over urination. If an older adult notices any changes in their bowel habits after starting a new medication, they should consult their doctor to adjust their treatment regimen. Thus, urinary disorders or changes in toilet habits are important signs that the elderly should not ignore. When experiencing these symptoms, seeking early medical help is very important to detect the cause and treat promptly, avoiding possible dangerous complications. In life, our health is the most valuable asset, especially for the elderly. As we age, our bodies are more susceptible to changes and abnormal signs, which many people often ignore. However, serious health warning signs, such as unexplained extreme fatigue, sudden and severe chest pain, shortness of breath, sudden weight loss, memory loss or mood changes, urinary disorders, changes in bowel habits, and severe abdominal pain, are all important warnings that no one should take lightly. The important message from these signs is, we must listen to our bodies and not ignore any symptoms, no matter how small they may seem. When encountering these signs, quick and timely action can help detect dangerous diseases, thereby increasing the chance of treatment and protecting health. This is especially important for older people, because as we age, underlying diseases are often difficult to detect and can progress silently without obvious symptoms. In addition, proactively checking your health regularly also helps detect potential health problems early. Regular tests and examinations will help doctors detect abnormalities in the body that we cannot detect ourselves. This not only helps protect our health, but also helps us maintain an independent, self-reliant life in our old age. Finally, the most important message is not to hesitate to seek medical help when there are any unusual signs. Timely action can save your life and help you maintain long-term health. Don't wait until your health condition becomes serious, because by then it may be too late. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to Seeing you in the next video.